Hello, everyone. I'd like to welcome all of you to our monthly webinar for bariatric surgery in Mexico with MDC. I'm still waiting for everyone to join so we can get started. I hope everyone can see me. So I have, let me see, you join me. So I would like to, since we are waiting, I would like to mention about our raffle today. If you guys have not entered or filled out one of our health questionnaire online, which is you can find at mexicobariatriccenter.com/, health-questionnaire/. And if you haven't done that, please go ahead and do so. So you can be eligible to enter to our raffle. Also, I'm still waiting for Dr. Louisiana Valenzuela to join me. Okay, I can't see you, Maria. I can't see you, hear you clearly. Okay, so I want to, yeah, I can put that in the link.
Hi, hello, Ron.
Hello, good morning, Dr. Brown.
Good morning.
How are you?
Sorry for the delay. I was having a technical complication here, but I am okay now.
Good to see you.
Good to see you too.
Yeah, we're just waiting for everyone to join. And we get started shortly. I'm just putting the health questionnaire link in the chat. I hope you can find it. So in order to be entered in the today's raffle, you guys need to, basically this raffle is for Dr. Valenzuela, and we cannot honor it for any other surgeon. So if you fill out a health questionnaire with another surgeon, we switch you. You don't have to redo the HQ, but the surgery will be performed with Dr. V, not with any other surgeon. And if you're scheduled already, but your surgery is coming up, you're still eligible to enter the raffle. Yeah, if you have done the HQ before, don't bother to do it again. We can just switch your name. Switch the name of the surgeon to Dr. V. And okay, so I think we got pretty much stable as far as our viewers joining us. I want to say hi to everyone. Dr. Valenzuela, thank you so much for taking time to joining us. I am in our office in Sacramento, California, and Dr. Valenzuela is actually in her house, I think, in Tijuana, Mexico. So basically, we've been doing informational seminar and webinars since 2014, and after pandemic, we pretty much started doing webinar, and we're now going to different locations in US or Canada. So today, my name is Elli. I'm the CEO and founder of Mexico Bariatric Center, and Dr. Louisiana Valenzuela is our chief surgeon of MBC. And as I said, she's joining us from Tijuana, Mexico. Again, if you have filled out a health questionnaire, you don't need to redo it. We just have to switch your name to Dr. Valenzuela. We try to answer all the questions that are frequently asked. So please pay attention. And as much as we can cover, there are going to be more questions. If you have more questions, of course, use the Q&A tab to enter your question, and we would enter at the end of the presentation. We try to answer as much as we could. So again, it's important that everyone listens to all the information so we don't have to repeat it, so we can cover as many as those Q&A at the end. So the topics that we're going to cover today is basically obesity, risks of being overweight and obese. We'll talk about weight loss surgery, and we talk about MBC and what we do at MBC. And Dr. Valenzuela, Dr. V, is going to take over after that and talk about bariatric surgery options, the pros and cons of it, laparoscopic versus endoscopic. And as I said, we would open up to Q&A. We will talk about emerged bariatric vitamins, and we do the raffle. So people who have done the health questionnaire and qualify for surgery and attend this webinar all the way to the end, their names will be automatically entered in the $2,000 off of surgery packages. So we all hear this BMI. BMI is just the body mass index. It's just an indication of where our body or our health is categorized. So basically, if our BMI is less than 25, we're pretty much in the normal zone. And if we go over to 25 and we are less than 30, then we are in the overweight zone. After that, it's considered obese. And after 40, then you are morbidly obese. And then you go to super morbidly obese and super morbidly obese when your BMI is more than 60. So one of the pluses, like we're going to cover at the end, what is the pluses with going with MBC is that we can cover all type of BMIs, of course, more than 30, maybe, well, I would say 28, because there are some endoscopic procedures that you can qualify with 27 or 28, and we go all the way to BMI of 100. Obesity is a chronic disease and is growing worldwide in US as well as rest of the world. As far as the percentage of obese people, US is not number one, but if you count the number of people who are obese and overweight, we are in US, we are up there. Basically, human body is not used to the high calorie of fast food, sugary drink, ultra processed foods, and we're not built to have no physical activity or very little physical activity. We are built to be active, to walk around, to hunt for our food, and not to have so much high calorie foods available to us. So we basically have no defense, and that's what happens, that we gain weight. And obesity comes, of course, with so many other underlying medical conditions. But in general, our genetics, the environment that we're growing in, the developmental history is all factors of where we stand in the BMI chart. Again, lack of physical activity, stress, inadequate sleep, and the drugs, a lot of the drugs we take for various reasons, they're all contributing to this, pandemic, obesity pandemic. So when we gain weight, basically the fat cells are growing its size and volume. And not only that, their structure is changed. So before, the notion was we just gain weight and the size of the fat cells or adipose tissues increases, but that's not the case. And when the structure changes, now you have the dysfunctional problem. So the dysfunction of adipose tissue contributes to insensitivity to insulin, leptin, therapies, even vaccination. And what happens when our body is not responding to insulin in the body is like, now we have diabetes type 2. Now you have to use insulin. When you're not sensitive to leptin, you don't feel satisfied as fast, and you keep eating more. And so that's what happens. So the two pictures on top and the bottom of my right of my screen, or your screen, shows how the obese adipose tissue is different from lean adipose tissue, and you see it's inflamed, and also the structure is changed. Obesity is impacting, like we talked about, 40% of adults in the United States alone. Comes with major risk factors. I like this animation to show what happens when we gain weight in the abdomen. So let's try to play that.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So we talked about, cardiometabolic disease. So heart disease, diabetes type 2, stroke, lung disease, impaired immune system, chronic inflammation, blood clots. These are all side effects of gaining weight and the fat cells changing structure. So now during the COVID, as we saw, obesity was a major risk factor, and that was added to other problems that comes with obesity. And the reason is, of course, the coronavirus wanted to attaches itself to the fat cells, and the more fat cells you have, basically you have more touching areas for coronavirus to attach itself and make you sick. So the question is, what is the cure for obesity? Of course, diet and exercise is always great, but it's not a proven long-term solution for obesity. Now we talk about the drugs. There is a new injection, Ozempic, that has been popular. All the diet pills, FAP dieting, Atkins, all those diets, also not long-term solution for obesity. We can talk about injections if you want, but that you have to keep using it. And then if you stop using it, then you're going to gain the same weight you lost and more. And also you have GI problems. It has so many side effects. So it's not a long-term solution. So bariatrics is the only proven fast and long-term solution for obesity at this point. And I like this animation where it shows that when you go on diet and exercise and you want to change your diet on it, eat healthy. Of course, eating healthy, being active is always good, no matter what. Even if you go through bariatric surgery, you still need to have the diet and exercise in your life, everyday life. And but what happens is your body is gonna, go against that weight loss, and it's by decreasing your metabolism, increasing your hunger, and decrease your satiety. So basically, bariatric surgery, weight loss surgery, resets your metabolic system. So basically, it resets the way your brain and your gut hormones are interacting. And that's the trick that makes this be a fast and a long-term and a safe solution. Because the minute you go through the surgery like gastric sleeve or bypass, your hormones are changed and the way it interacts with your brain is changed. This demonstration on my right or on your right of the screen shows an individual that weighs 250. At that weight, their brain and their body's thermostat is used to operate around that weight. If you do diet and exercise, and we're talking about exercise like boot camp type of exercise, and you lose 75 pounds, your brain still sees you at the 250, so it's trying to make you eat more. You're more hungry, your metabolism goes down to save energy. So nothing has really changed in your body. When you go through bariatric surgery, however, the minute you wake up because of a hormonal change, your brain sees you at 175 pounds. So what's going to happen is you're not going to get as hungry and your metabolism goes up. So you burn fat fast, and you won't eat as much. So that's the trick. So if you're uninsured or underinsured, or you cannot afford to get this life-changing surgery in where you live, that's when you travel for what we call medical tourism. You go to other countries for medical procedures, like bariatric surgery. So this is where we come into picture. We are making the guesswork out of this traveling to Mexico and getting this life-changing, life-saving surgery procedure. And we basically offer quality medical care with VIP treatment. Like I said, when you go with MBC, you have peace of mind. All your transportation, your hotel reservation, your stay, hotel, hospital, all that surgery, of course, the part of the surgery, pre-op, post-op, they're all being figured out for you, and you don't have to worry about a thing. The minute you land in San Diego, you're basically in our service, and we will provide this service. When you come back, you go get the surgery, come back through this wonderful machine we have that been working for over 10 years. Basically, MBC is a US corporation in California, and our mission since inception has been providing quality bariatric procedures at affordable prices. Of course, safety of patients are number one. These are all the pluses to go with MBC. There are so many of them. You know, our reputation, our reviews out there on Google, Facebook, media. We match the best surgeon to each patient and the best procedure for each patient. That's a plus, that you will not get something that your body is not going to need or is a wrong procedure for you. Our packages are all inclusive. We use bariatric certified surgeons. We do so many different procedures, endoscopic and laparoscopic. Scheduling with us is very easy. It's 1, 2, 3. We do informational webinars. We do webinars for pre-op, post-op. Our post-care, after surgery, you still have lifelong care and support from us. The results that our patients have, you can see on our Facebook support group that our surgeons are expert to do the sleeve and bypass the right way. We are a Better Business Bureau, Medical Tourism Association certified. We help you with your FMLA, return to work forms. Our nutritionist is here in our office supporting you before and after. And we've been in medical tourism for bariatrics for over 10 years with over 20,000 successful procedures. And last but not least, we offer what we call international medical tourism complication coverage that, of course, is optional, but we highly recommend that. It covers you for your travel as well as any complication that may arise from the procedure. As we have always improved our quality of our services, one of the endeavors that we took over was from 2021. We've been designing our own surgery center. And as you see, we are in a process of working to get it, hopefully go online soon, and we will have our own surgery center. Again, like I mentioned, we've been in medical tourism more than 10 years, 20,000 surgeries, successful surgeries, and top 7 quality surgical teams down in Mexico. Our packages include all the maneuvers or touches that you need down there, from surgeon fees, hotel fees, hospital fees, pre-op, post-op tests, nutrition support, private transportation. All that is included in the package. Of course, like I mentioned, the MTI, the medical tourism insurance, is optional, but we offer this really great option at half of the price that if you were to acquire that directly through that company. Our getting you on the schedule is very easy. It's a 1, 2, 3 step. Step 1, you do the HQ, you get your approval. You deposit the $350 or the $500, and now you can be added to the calendar. Once you're in the calendar, you book your flight or you arrange for your arrival to San Diego International Airport, and you fill out the forms that you need to complete, and you're done. That's as simple as that. We actually have a way for you to be able to book yourself online. So once you get your HQ approval email, you can actually click on the link and go and find the date that works for you, make the deposit, and book yourself. Support is a huge part of this process before and after. You know, we do have several Facebook groups. One is the main one that our past patients are participating, over 10,000 past patients. And we have another one which called Inside Facebook group. That's for people who are just learning or they're on the fence. They're not quite ready to go. That's the one they can participate in everyday discussions and find out if this surgery is good for them and what options is good for them. And of course, our staff are always around to help you in these groups. We have several of our past patients that work with us day and night and support patients. Kelly, Rena, Dawn, Judy, and Sarita. Sarita has been a big part of our affiliate program for a long time. Also, like, you know, these patients trusted us and they're still supporting us with our future patients. They do have also a podcast that is very interesting. I recommend that you watch those podcasts. It's very informative. So again, once you go with us, you don't have to worry about a thing. You just book your flight or driving arrangement. And once you arrive, our driver is circling around the airport, whether you go to Terminal 1 or Terminal 2, to bring you to our hospital facilities in Tijuana. We have 2 teams of drivers. These are the drivers that have been doing this for years. In picture, you've seen Willie. He's one of our drivers that has been with us for, I don't know, maybe 10 years. So these drivers are all professional, they're local. They understand all the areas of Tijuana and they know how to get in and out. So you are in safe hands once you arrive. Of course, a big part of this whole journey is to go to Tijuana and get this life-changing surgery with top surgeons. These are the 7 best surgeons in Mexico right now. And we are very glad to work with them. And we work exclusively with these doctors. Dr. Louisiana Valenzuela, like I mentioned, she's our chief surgeon. And she's been with us since 2012. Dr. Miguel Montalvo, Alejandro Gutierrez, Rodriguez Lopez, Jacqueline Osuna, and Jesus Ceja. So this is what makes us different as far as matching the best option and best surgeon with each and every patient. So as you see, patient does the health questionnaire. It goes through the surgeon liaison, which is, she's a bilingual doctor that sits between you and the surgeons and make sure the traffic goes to the right place. And then these HQs go to the best match for each patient, and then they get an approval and they go back with the letter or email saying you're approved. Of course, our nutritionist and our patient coordinator, that's going to be a case manager for you from A to Z. So every time you call, you don't have to explain again what your case is all about you, or about what type of surgery you're getting. So you be talking to the same person from A to Z. So that's really a plus. Our pre-op diet program, it's very straightforward and simple. It's based on the BMI, and it goes from 2-day clear liquid, and it gets added more days as your BMI goes up. Of course, these are all coming to you with our nutritionist. They tell you how many weeks or days you need to do pre-op diet. And They do webinars time to time, so you know what to do and what not to do. We are working with Me Doctor Hospital for years, and the pluses of this hospital is they know what to do as far as sterilization in the ORs, and they do work very closely with our surgical teams. We use Hyatt Place right now in Tijuana. It's a very high-end hotel. They provide broth and popsicle and jellos for patients, and they would have free breakfast for companion once the companion stays in the hotel. We're very glad to be able to work with Hyatt. So the day that you arrive, we do all the pre-op test, and we keep you in the hotel the night of your arrival, so you be relaxed and ready to go for the next day. On the day of the surgery, they pick you up, take you to the hospital, and the surgeon go and meet with you and prepare you for this life-saving procedure. This is actually a picture of Rena that we saw before. She's one of our affiliates with Dr. B. So we keep you in the hospital for 2 or 3 nights based on your procedure. We do multiple leak tests, and you're ready to go back home. Of course, people who are traveling long distance, or they still want to hang around one more day, we can arrange for their hotel stay after their surgery. We talked about pluses of going with MBC is one of them, which is a huge part of our success in low complication, is the surgeon's load management. So basically, we manage each surgeon load. The type and number of surgeries they do is controlled per day. So we have a capacity for each surgeon, and once we reach that, we don't book for that day anymore. So that's why our complication rate is less than 1%, and our success rate is high. These are different type of procedures that we provide. I probably let Dr. Valenzuela take this part and explain all these different procedures that we offer.
Hi. Well, I am happy to be here with you, trying to explain the most possible your questions to when you come to get the surgery, you have the less doubts about your surgery. I am Dr. Valenzuela, like Ron explained. I am 45 years old, working in bariatric surgery for 15 years, working with MBC 12 years ago. And well, we are very expertise surgeons here, getting all this experience through all these years doing all the surgeries. Well, I have in my experience more than, I think, 7,000 surgeries, improving every day to give to the patients the best recovery time, the less complications rates. I am very happy that the last year I had maybe 2 or 3 very small complication in all years. So we are doing the surgery, the safety possible to you. Could you give me the next slide? We are having all these procedures in our techniques hands. Everyone is different to get any different procedures. Depends your disease, depends your weight, depends of your BMI. We are having these different type of procedures. The first one you can see, gastric bandit, is old procedure who is not more in our list, but we know a lot of patients have this lap band still. So they come to get off the lap band, to get the revision surgery, to other actual procedure like gastric sleeve, mini gastric bypass, full bypass, different. You can change lap band to any other procedure, and the patients depends of if have or not diabetes or acid reflux or another issue, we can change to other. We have the gastric sleeve surgery. The mini gastric sleeve, it's a name who is used to the minimal invasive technique with 3 incisions, just 3 incisions, but it's not different the technique in the stomach. It's the same like the gastric sleeve, but now because we are doing just 3 incisions in the wall, they are named this procedure mini gastric sleeve. And this is depends of the patient, of course, and how much BMI they have, if they have scar tissues or not, if they have a big or not liver. That is the way to do or not these 3 incisions. Depends on the specific things in the patients, and the liver, the hiatal hernia, the previous surgeries. We can or not do these 3 incisions gastric sleeve, or single incision gastric sleeve too, because that depends on the size of the liver, the BMI, actually the single incision gastric sleeve have more specific conditions to get. It's 30 to 35 BMI, no previous surgeries, the liver need to be very, very small, and with no hiatal hernia, because if you have hiatal hernia, we need to repair it, and we need the retractor liver to get better exposition in our surgery. So that is the difference between the single incision and mini gastric sleeve to choose the procedure in every different patient. Because in the 3 incisions mini gastric sleeve surgery, who is the 3 incisions, I called it in patients like 50 BMI. Because they did a very good pre-op diet and they have a very small liver, so I don't have problem to do this surgery, gastric sleeve, with 3 incisions. But the single incision is through the belly button, so it's no possible in patients who have 50 BMI or more than 35, because it's complicated to go through the belly button incision. So the bypass, the mini gastric bypass, duodenal switch, the single anastomosis duodenal switch, who is like the version of the mini gastric bypass in the bypass full surgery. And well, many different kind of revisions. Sleep to bypass, sleep to mini bypass, to duodenal switch, to single anastomosis duodenal switch. And it's a very different situations to get revision, and different option depends of why is the reason to get that revision, if it's acid reflux, or if it's just reganate weight, or if it's lab band to other procedure, or bypass to bypass, etc. So everyone is individual candidate, and we need to check what is the best procedure for everyone. And not all the patients can have the same procedure. We recommend, depends of the BMI, diabetes, etc., different issues or disease the patients have, the years, the age, the previous surgeries, etc., or disease condition. So we check the health questionnaire, and we say every doctor check if it's good, the procedure, the procedure who the patient choose or not, and we recommend our best procedure for everyone. So could you get the next, please? Well, the gastrosleeve surgery, you can see, is a restrictive procedure. We cut the 80% of the stomach. We let just the 20%. The shape is like a banana at the end. I saw one question here in your your questions here in the webinar, if it's possible or not to cut less stomach, like just 50%. No, it's not possible. Of course, we can do it, but it's not the correct technique. If we do more or less, we are not doing the sleeve surgery. The sleeve surgery have a very strictly technique to give you the correct approach in your surgery, the correct weight loss. If we cut less, like 60% or 70%, it's not working or nothing. We cut more, trying to give you a little more weight loss. We can give you complications like narrow zones, leaks, ulcers, different kind of complications. So the correct technique is to get up to 80%. You conserve your 20 in the correct shape to get a very good way to the food coming, and you can absorb the food without problems, with the less possible acid reflux with the surgery. So it's a very, very technique, refined technique for us to give the best weight loss with any bad quality of life, because it is very important we give you a very, very good quality of life after surgery, getting a good time, eating time with any discomfort at the end, and you could eat the food with not problems, with not discomfort, with not pain, with not reflux, acid reflux. So of course, it's impossible to say 100% you won't have any, like the most common is the acid reflux, but we care if you have acid reflux before, we care and we try to know why you have this acid reflux. It is for your habits or is for dysfunction of your sphincter. So it is a hernia, so we need to repair the hernia. We need to give you the cover that part. We need to cover that part to avoid the possibility to get acid reflux after the surgery. So what we expect with any bariatric surgery, I will talk about all the surgeries here, give you an improve in diabetes, and if you have high pressure, if you have a syndrome of ovarian polycystic ovarian, you have hyperlipidemia or hypercholesterolemia, you will improve with any surgery, sleep surgery, mini sleep surgery, mini bypass, gastric bypass, duodenal switch. All the surgery give you that advantage in your disease, diabetes, high pressure, etc. And we are having very equal weight loss in the patients with all techniques too. It's a little more aggressive, the duodenal switch, of course, the bypass, but we need to explain what is the difference here. The sleep surgery is a very safety, fast, and the quality of life at the end with the sleep surgery is very good. It's very good because we need to take protein vitamins for a while, maybe 1-2 years after surgery, and then you will have the opportunity to get all that protein and vitamins from the food. The first years is a very restrictive procedure. Year by year, you will see you will have a little more stretched stomach to get a little more food. But in these previous 2 years, when you start with the sleep surgery, is when the patients change their habits to healthy food to continue your long-term weight loss with this surgery. If you don't care that, you could regain some weight, but this is the patients need to understand when you get the bariatric, you need to change with this surgery to get the new habits, who is the important to your long-term weight loss. This is a very good tool treatment for obesity to weight loss, but it's a new life, a new style of life, a new habits to get the best long-term results, because the surgery, specific in the gastric sleeve surgery, is very magic the first years because it's a very restrictive, all the surgeries, but we are talking about gastric sleeve. But at the end, if you come to get again the hypercaloric foods, and 4 or 5 years you could have the regaining weight because your restriction, it will be a little less than the first years, and at the end the tool is working in less percent than the first years. And if you don't care that aspect, you could have the some regaining weight. But the good for this surgery is the safety time, short time in surgical room. It's faster recovery, and your quality of life about you don't need to take vitamins and protein all the time for the rest of your life. Sorry. Okay, we have cons in sleeve surgery. The Crohn's disease is the absolute crunch for any procedure, but more in bypass in the intestinal small bowel procedure. In gastric sleeve could be a problem if you have previous episodes important of Crohn's. The bad acid reflux is a cons because we know the restrictive procedure push the acid up when we have a very restrictive spacing of our stomach. We have more chance to get more acid reflux. So we recommend more the bypass surgeries to avoid the acid reflux increase. The pros is, like I say, is a very quick surgery, safe, with no change in your anatomy. Just we cut the size of the stomach, but we don't manipulate any small bowel or intestine. So that is the pro too. Okay, it's not malabsorptive surgery. It's just restrictive, but we have a very good improvement in diabetes and hypertension and all that kind of disease. We have the malabsorptive surgeries like bypass, mini bypass, duodenal switch. We have these surgeries for patients who have bad acid reflux, diabetes, high pressure. This is the ideal procedure for that patients. We know the gastric bypass is the number one to resolve your diabetes, to resolve the acid reflux, or prevent the acid reflux, because we don't have any pressure in our anastomosis. We just have an open way to the food coming to be down with not push up again. And we have this procedure to patients who want long-term more, they are not wanted to be any possibility to regain weight, but they need to understand that this surgery you need to be a little more constant in your vitamins, in your protein, and checking your levels of vitamins, because this is a malabsorptive surgery. So we need to be more care in our medical appointments to get every year the lab test to see what happened with our vitamins and adjust in case we need to adjust the levels of B12, B1, B6, iron, etc. And this is for patients who are more disciplined, because you need to be in constant checking time with your doctor to don't have any problem in your vitamins, protein, and all these things, who is very necessary to care with these malabsorptive surgeries. Okay. Well, the dumping syndrome, like this slide says, it's a reality in all surgeries. This is more for when the patients don't follow up the instruction in the diet and they are taking food with a lot of sugar, a lot fried food. We have this we are receiving directly to the small bowel all this food, heavy food in that aspect, the sugar or fatty food, and the stomach in the small bowel respond given a reaction like diarrhea, like vomiting, because all the intestine are rejected the food, that happy food, because it's usually the new way to receive the food is different, and if we put that kind of food, the stomach and all the small bowel have the bad reaction like the dumping syndrome. So it's a very low the portion of dumping syndrome if we are a very disciplined patient and we don't eat food in that way, the hypercaloric food, the sugar and everything. Okay, the surgery is a little more long in the surgical room. It's 1.5 to 2 hours in our hands. It's 3 days in the hospital. A difference of the sleep surgery, which is just 2 days, and it's pretty much the same recovery, but we need to check more time the patients because it's a different sites of anastomosis. So we need to be a little more careful in the evolution to see everything is perfect, it's good to come with any problem. So it's just a little more time checking the patient, but it's actually, I see the same recovery time sometimes, like the sleep surgery. The patients have like nothing the second day, taking liquids, but it's more for our mental peace to see the patient are good to go home without any problem. Okay. Okay, we choose the surgery, like I say, depends of BMI, depends of if you have diabetes, acid reflux, etc. And we give you the best option. We are, of course, recommended our best option for the patients. Everyone is different. It's different because different age, different. If you are honest patient and say, I am 40 BMI, but I am not very disciplined patient, so maybe you don't want to get duodenal switch, who is very strictly surgery to be very disciplined patient, taking all the vitamins, all the proteins, with not option to don't take it because it's very, very important being the level because it's very malabsorptive surgery. So if you are more scary about the malabsorption, you can get the gastric sleeve with any problem. But like I say, if you have a bad acid reflux, we will recommend the gastric bypass, because if not, you will have a bad quality of life with that more acid reflux, and we don't want that for the patient, and it's not ethical to perform surgeries when the patients already have the problems with acid reflux. So we check all the different patients, depends what they have, and we recommend the different surgeries. Okay, the gastric sleeve could be get a revision for bypass, for mini bypass, for duodenal switch. So if you have this option and in the future you regain weight for some reason, any reason, you could have a revision for gastric sleeve to any other procedure. Okay, the mini gastric bypass is I like so much this surgery when the patients want a revision from sleep. and if they don't have any problem with acid reflux, I like so much because it's a little more malabsorptive than gastric bypass and give you a little more improving your weight loss. I like these patients. It's the same. We need to check if you don't have acid reflux, any problem with that. You can get this surgery with any problem because it's a very good and malabsorptive surgery to give you weight loss improve when you regain some weight. For first time, it's good too if you don't have any acid reflux. The cons is the acid reflux, because we have the chance to get bilious reflux even with this surgery, not just acid reflux. So I am very specific with these patients. If you have acid reflux, it's better the complete bypass, the full bypass, the in way. But if not, it's a very good surgery because we are jumping 2.5 meters directly, and we have this better weight loss with these surgeries. It's less time in surgical room than the full bypass because we have just one anastomosis. And at the end, if you have any problem of acid reflux, we can complete the full bypass in the mini. The full bypass is the excellence for diabetes and acid reflux patients. We have a very good results with the bypass. I like so much the bypass too because I know I won't have any problem with acid reflux in the patients. I will control the weight loss long term, and to me it's a final surgery for the patient because it's the perfect equilibrium and the malabsorption restriction, and we don't have the possibility to get acid reflux. And at the end, it will resolve all your issues in diabetes, high pressure, etc. So the patients, to me, who are in the are candidates to get a bypass need to be under 50 BMI. We have a concept, more concepts to get a bypass in 2 steps after the 50 BMI because it's a little more risk to the patients to get bypass with more the 50 BMI. It's a tense anastomosis, it's a little more risk to get leaks, bleeding, etc. So if you have 50 BMI, you can get a sleep surgery, and then when you weight loss, if you are worried about I am diabetic, I am with in the borderline 50 BMI, so you can get 2 steps bypass. First step, sleep surgery, you weigh all your heavy extra weight, and then when you lose weight to get maybe 30-35 BMI, then you can get the full bypass in the second step and get your long-term control of all issues. Or some patients don't need the second step. With the sleep, it's done all the issues, and they have a very good quality of life. They feel good. They feel they lose all this overweight and resolve all the problems and don't need the second step. But every patient is different. Some patients respond different to the surgery. In that case, you can get the 2 steps. First step, sleep, you lose the weight, and then get the gastric bypass if you want. For example, if you have an acid reflux, but you are 50 BMI, and it's dangerous to get the big surgery like bypass or the switch another, you can get First step, sleep, and second step, bypass to resolve your acid reflux in the second step. The ideal, of course, is to don't get two surgeries, but some patients, it's very risky to get the big surgery in the first step. If you are 50 BMI or more, the men are more abdominal, central obesity is difficult to technically to get a big surgery like bypass. Sometimes it's heavy, it's not free from TENS. So we need to care that aspect in the surgery, not just do the surgery because the patients want that surgery. We need to explain, need to be a safety surgery, very safety surgery, to don't have any possibility to get a complication. Okay, duodenal switch, like I comment, it's a little more aggressive surgery, malabsorptive. You need to care and be very strictly eating, taking all the vitamins, protein, and you have a little more chance to get dumping syndrome. You need to check maybe 2 times a year your levels of your vitamins, and this is for all your life. So if you think you be in your very strong change of habits and be strictly disciplined in your surgery, it's a very good surgery for the high BMI patients, and for the patients who wants long term, of course, weight loss forever. But you need to understand this is a little more aggressive surgery and strictly for your habits. The patients lose maybe a little more weight than other surgeries. It's now in our expertise hands, in our doctors, in our surgeons. It's not too much time in the surgical room. Actually, maybe sometimes it's 2 hours, 1.5. It's a good for our patients who have diabetes too, and we have a very good improvement in results and very low rate of complications now because we are with more experience in that surgery. So, well, like I say, well, we need to care every patient, the good results in the company team of the surgeons is because every doctor have their own team carrying their own patients. So we don't have one patient for all different doctors now. Everyone have their own team. So it's more short, the communications for the patients, the caring of the patient is more close. So I have my own team caring my own patients, giving all the attention the most possible to help if you have a little issues after surgery, a little pain, we control that fast. We have a very communications every doctor with every patient. So that is a very good advantage that give us better results with every patient because it's a close communication with everyone. So you will see a different in many patients, but everyone have their own surgeon and their own team caring every one patient. Okay, so we receive the patient, do the pre-op evaluation for everyone. New labs, it's here. Even if you got your own lab test, we do a new ones here. We need to see what happened that day before you going to be in surgery. Even I saw one questions, even the blood clot time. It's important to, even if you got that lab test before, we need to check again. We do a pre-op evaluation with our internist, checking your EKG, your labs, and your physical condition to get surgery. Patients who have more than 60 years old, or maybe less than 50 years old, but with previous history of cardiac events or thrombosis or etc., we need to get a cardiologist clearance to come because we don't want you be here and don't be approved to the surgery when you be here. So we need to be the most sure possible to get a green light to get that surgery and don't have surprises here. So that kind of patients have more issues, and we need to check first the cardiologist clearance to be safe here and get the surgery with the less risk possible. Okay, it's you come to the hospital, get the surgery. We carry you when you are very wake up from anesthesia. You go to your room, and then you will start to walking 2 hours after surgery, and you can start with eye shifts 2 or 3, maybe 1 hour after surgery. Sometimes in recovery room they are taking ice. The second day we start with liquid diet. We do a leak test. The second one, the first one is in the surgical room, and you start to walk 2 hours after surgery. Like I said, that is important. Exercise, breathing, walk, and be the most active possible to prevent any complication like collapses in your lungs, clots. Who we don't have any in the last maybe 6 years or 8 years any clot, but because we are preventing all the time. And we will give you blood thinners to prevent when you come back to home, any clot at home. So we have a very, very good results, very, very low rate of complication, because in all these years we are having more and more experience what we need to do after surgery to the fast recovery, because we know you need to come back at flying, and you need to come back to work. So the most common questions are when we can come back to work out, to swimming. So if you go to the pool just to walk, you just need 2 weeks. When you see your incisions dry, you can go to the pool. To do a heavy exercise, you need to wait 6 weeks. And if you have a desk job, in 1 week, you could come back to work. If you have a little more activity in your work, I recommend 15 days. If you are getting a heavy work, like lifting heavy things, you need to wait at least 1 month to 1.5 months. Okay.
Well, thank you so much for sharing all that information. I'm sure our viewers are enjoying all that. So we would take more questions at the end. So just gonna quickly go over financing. Our packages are very affordable. You save pretty much more than 50% of what you would pay in US coming with us. Our packages start at 4,595 and go up based on the surgeon, based on additional fees. But if you need financing, we have several channels that we go through, Super Money, e-financing, United Medical Credit, all those are there for you. Also, you may want to check just individual lenders like SoFi and Lending Tree, all those guys, just like for a personal loan. I recommend that you don't apply for more than 2 at a time, because every time you apply for a credit line, it thinks you're scoring, and it would make you less qualified for a loan. We were talking about what are the benefits of going with MBC. We offer discounted medical tourism insurance for travel reasons and for complication. As you see, these are the limits that they cover for surgical treatment, or basically, if you have problem with your travel, of course, we talked about diet and exercise, that you want to have it in your lifestyle. And when you go through bariatric surgery, definitely you need to take bariatric vitamin for gastric sleeve bypass, especially. And for DS, definitely you need to have nutrition supplement. So these are the emerged bariatric vitamins we offer: is soft chew, chewable, and drinkable, and capsules. And you can order those from emergebariatrics.com or order it when you do your consent form. So we have got to the point that we can start answering the questions, and after that we would do the raffle. So we have tons of before after pictures of people who have gone with us, husband and wife. We do offer cosmetic for post-bariatric patients as well. Tummy tuck and mummy makeover, those are pretty popular. We do have board certified surgeons that they're specifically experienced in post-bariatric patients. So let's start from the beginning. Anita is asking about the pre-surgery labs of PT/INR, even if you don't use anticoags. So do you know the answer to this?
Yes. It's important to get new labs for everyone, even if you don't take any blood thinner. So yes, it's important to get the new labs for everyone.
Okay. So actually, this is a good point to bring this up again. The fact that we do all the pre-op tests that is needed for blood test, EKG, all that. But especially for patients who are coming back for revision, your hemoglobin levels are very important. So it's just a check for you to make sure you don't have any deficiency. And when you come there, it will be, a problem down there. We have to give you blood transfusion and all that. So it's better for you to check your blood before you come, just for your own information, especially like I mentioned, if you're doing a revision.
Yeah.
Okay, so this one, Sherry is asking if I need an RNY and I have a hernia that can't be repaired until I lose at least 100 pounds, would I have to wait to have that procedure?
The procedure who you are talking is about the repair hernia. It's not possible to repair the wall hernia in the same procedure like bypass or any other intestinal or gastric surgery, because we have bacteria in our gut, in our stomach, who could encrust in the mesh, who is needed to repair the hernia wall. So if we try to do the same procedure at the same time, we have the big chance to infect the mesh and get at the end a big complication in your hernia repair. If you have a hiatal hernia, it's different. The hiatal hernia is into the abdominal cavity, is in not in the wall, is in the diaphragm between your esophagus and your stomach, and we need to repair. That is mandatory when you have the hiatal hernia in this bariatric surgery, to repair that hernia. But you are talking, I think, in wall hernia. That is different kind of hernia. So it's not, you need to get the bariatric surgery and wait. It's better for you when you lose all the overweight. The surgeons could repair the hernia much better with less complication, like hematoma or seroma or infection in the mesh, and it will be a very aesthetic results at the end.
I would like to ask about how ghrelin and leptin are affected with sleeve surgery and what patients report.
Okay, the ghrelin is a hormone that these hormones are in, the leptin are in the cell, fat cells, and the ghrelin is in the stomach. These cells are modified when you get the surgery. Is one way to say to the brain if you are full or if you have hungry, but it's not just the unique way. We have a different way to say to the brain, I am hungry, I am empty, I am low of my glucose in my body, and it's different way to get this information in our brain to give us the stimulus to go to it. The leptin and the ghrelin, they are improving in this aspect with the bariatric, because we are cutting that weight, what part in the stomach, in the top of the stomach, we have that ghrelin who send the signal to the brain to say, I am empty or not. And we cut that part. So we quit that part of the signal to say to the brain, we are hungry. So that help in our improved time to get the weight loss. It's true that we still have hungry after surgery. I want to clarify that myth, because it's a myth who is for sure you won't have hungry after. No, because it's different ways to say the brain, I am low in my glucose, I am I need to eat. But it help a lot. It's like an extra help in our brain to say, I am not hungry. So it's not 100%, you won't have hungry, but help a lot when we cut that part of the stomach, and the leptin respond to the weight loss and all this change in our body.
I would like to ask, what do you see in patients over 60 years of age who have the sleeve, and how they can recover and respond to this surgery?
We have a very good improvement in that patients. I did bypass, I did sleep for that patients. They are controlled diabetes, high pressure. Of course, the quality of life improved a lot because in that age we have a little more pain, articulation pain, all this is a little more tired for our body in this extra weight we have. And it's safety for that patients. Of course, we took some different precautions like cardiologist clearance to be, you are controlling your pressure and you are with not any important disease to get surgery, but if you are in control in your diabetes or high pressure, we can do the surgery with any problem. Yeah.
So they're asking, how long before and after surgery do I avoid coffee and regular food?
Okay, it's just the first months, the first 2 months maybe. Your stomach, it will be a little sensitive. It's the full complete healing process is at 2 months after surgery, in any surgery. So we need to wait until you complete healing your stomach and don't receive any aggressive like coffee. It's a little aggressive sometimes. So when you finish your complete healing process, you can take your coffee again.
Okay, so now there's a question about companion. And so since pandemic, we haven't kept companions in the hospital just for the safety of the patients themselves, of course, our staff, our surgical teams, hospital staff, for everyone's sake. Since pandemic, we have not kept companion in this hospital. So the way it works is we book hotel for the companions when the patients are in the hospital. And of course, patients in Hyatt, companions in Hyatt have free breakfast. There are a ton of restaurants around. They can go eat or eat at the hotel. They do have visitation time, and they do take them to tour of Tijuana. So there are plenty for them to do, but they're still there around the first night. They stay with you, but when you go to the hospital, they stay behind. Now here comes another issue, is like there are some companies that are still letting companions stay in the hospital. Again, even the authorities, the federal government, COFEPRIS, after pandemic, it was denying the companion stay. So they are not probably going by the rules because, when you have the companion stay, there's a lot of movement, and that's not recommended at this time. I'm not sure what Anita is asking for April 20. Okay, so can I still get pregnant after mini gastric bypass?
Yes, our recommendation is to be very careful in the first year. You need to be sure you are getting pills, control natal pills, control birth pills, because it's very easy to get pregnant after surgery. all this control of the hormones come to be controlled again. Especially in patients who have this polycystic ovarian syndrome, they resolve in the first month, sorry, that syndrome. In the first month, they get to be pregnant. They are confident and they never get pregnant before. They don't took the pills, their control pills, and they get pregnant. But we are always give the information to be very strictly in your birth control pills or wherever you use, because it's not recommendable to get pregnant in the first year. You need to wait at least 1 year to the vitamins, protein levels come to be a little standard, and then get a good evolution in your pregnancy.
Sam is asking, I have a hernia mesh with a BMI of 35. What's recommended for the surgery type? So they have a BMI of 35, but they also have a mesh umbilical hernia.
Oh, okay. No, it's not a problem. That sometimes we don't touch that part even. We try to avoid that part to go into the abdominal cavity with not touching any previous mesh area. But in case we have the mesh in our area work, it's not a problem. We never had any problem to go into the abdominal cavity with previous mesh repair hernias surgeries. No, don't worry, it's not a problem.
Is lap band as effective as gastric sleeve?
Is the lap band?
Lap band, yes.
Sorry, again.
So is lap band as effective as gastric sleeve?
Oh, okay. No, the lap band, it's not in our list now, like I said, because lap band, it's rear input in our body, who is getting us the possibility to get eroded stomach and leaks at the end, and bad acid reflux. We are with the lap band, some patients have improved and good results, but very low % of rate. At the end, we know the lap band give to the patient a bad education in their habits. Because they have a stuck foot all the time, they start to eat very liquid diet, but hypercaloric liquid diet. And the first years, maybe the first year, they have improved in their weight loss, but at the end, they start to regain weight because they are taking just hypercaloric shakes, ice cream, that chips, who is very easy to get down through the lap band. So when we receive that patients, we know sometimes it's difficult to change their minds, to change their habits and to the good and healthy food, normal healthy food, because they are using to take very lightly food, very soft food to pass the lap band. So we are not doing lap band, like I said, just getting off to change to the other procedure, revision procedure.
So they're asking about hiatal hernia. If you or if you find hiatal hernia repair needed during your surgery, do you actually fix it, and how much it's going to be? So I can tell you how much, but if you want to answer.
Yeah, we all the time repair the hiatal hernia. That is mandatory, like I say, it's not optional. It's necessary to repair to avoid acid reflux the most possible. And yes, it's part of surgery actually.
What happens to the staple in the body after sleeve surgery? Do they stay there for life?
Yeah, the staples are titanium staples, very tasted material in different kind of surgeries, not just bariatrics, gallbladder remove, orthopedics, brain surgery, etc. We know it's not reactive material because it's a long years tested in the patients. So it's forever. It's not any problem in the airports or it's always shown in the CT scan and that kind of X-ray test, of course, but it's not a problem. Just show that you have previous surgery. It's not reactive to get any cancer or any inflammation. It's really no reactive material and tasted for many years.
Is dumping syndrome also a concern for gastric sleeve VSG patients?
For all surgeries, less for sleeve, much more less for sleeve. But even if you do a diet, a strictly diet with not bariatric surgery, even if you do a diet and you are healthy, eating very healthy, if you change drastically to get sugar or to get fried food, you will have this dumping syndrome. Your stomach, your small bowel will receive very hard impulse to receive that glucose, extra glucose, and big shots of food, or fatty food, and they respond to that aggressive way to eat, and it's the vomiting or the diarrhea, they respond to your body. If you are follow up the diet, you won't have a big issue with any issue with the dumping syndrome. Believe me, I have the surgery. I got the sleeve surgery, and I know what happened after surgery, and it's not an issue. The syndrome, dumping syndrome. If you eat healthy, and don't take these extra shots of glucose. You can eat sugar, you can eat fatty food, but in very equilibrium with your diet. It's not quit at all. It's combine the food in the healthy portions, and you won't have any problem.
Amanda is asking, I had sleeve 2 years ago. What's the best revision for me?
It's good, the mini bypass, if you don't have any problem with acid reflux. I like so much mini bypass. If you have any problem, bypass is a very good option. If you have something more aggressive, you can get a duodenal switch if you don't have any problem with acid reflux, because if you have acid reflux, the duodenal switch you could still get the continue with the acid reflux. And in that case, you have the best option is the mini bypass or the bypass, the full bypass to get a revision. So, like I said, it depends of if you have or not acid reflux, how much you lose, how much you regainate, if you regainate some weight or you just want to continue weighing lost, if you are not regainate any weight and you just want to be coming to lose more weight because you are losing weight, but you want to continue losing weight with any chance to get back to regain.
So one thing they're asking about is, we don't require COVID test and we don't require vaccination. Of course, vaccination is great and it's for your own safety and everyone else around you. Also, if you could do even a rapid COVID test before your departure for you and your companion, that's great because that again saves people around you and yourself safe, and you don't have all the exposure when you travel. Do we need to stop our blood pressure medication before surgery?
No. You need to continue taking all days with not stop. Even the day of the surgery, you could take your pills in the morning with a very, very tiny small of water. If it's your horary to take in the morning, you can't stop your high pressure pills.
So they're asking if they're taking blood thinners. Do they stop blood thinners before surgery?
Yeah, depends what blood thinner are you taking. Is the days before you need to stop. If you are taking aspirin, you need to stop 7 days before. If you are with a Apixaban, it's 3 days. If you are with, well, depends. Sometimes it's 10 days, depends. Clopidogrel is 10 days, but there's a many different kind of medications. So you need to send what kind of blood thinner are you taking, and we need to say how many days you need to stop.
As far as, so when you enter Mexico with our drivers, they don't ask for passport, but when you're coming back to US on the border of Mexico to US, they are going to require passport book or passport card. We highly recommend you get that.
It's to me the question about the passport.
Passport, yeah, I got that. So how about hair loss? Does vitamin help hair loss after surgery?
Okay, it's a reality. The hair loss is around 20% of your thickness. You need to be under vitamin, protein, B12, biotin, everything to avoid more weight in hair loss. If you don't take the vitamins, of course, it's a little more percent of hair loss. If you take your vitamin and protein, it's not too much, but yes, it's around 20%. And in 1 year, maybe you will see the difference. You will regain it again. Hair, it's just a while. It's the fast weight loss time when you lose more hair, and then you will regain it again your hair. And don't worry, you won't be kelp or something. And if you take your vitamins and biotin, you will be fine.
So they're asking, Emily is asking, pre-op nutrition guide says to stop taking birth control 7 days prior to the surgery, and post-op nutrition guide says to stop taking birth control 14 days prior to surgery.
Well, it's our recommendation because the birth control pills are more promoting the clots, and some patients are more sensitive to do clots, and some others not a big issue, but we need to prevent that. In that case, you need to change your birth control to other kind of birth control thing, and you will come back to your pills 3 weeks after the surgery. It's not a problem, it's just to preventing clots in that aspect, who is a little more risk when you are taking pill controls.
I have iron anemia deficiency. I start infusion April 11th. How many infusions would I need to be qualified for gastric bypass?
Okay. The iron infusions work in your cells. We are having renovate cells in 60 to maybe 90 days, 2-3 months. So you need to get 2 months of infusions and get a new lab test to see what happened in your cells. If increasing your hemoglobin and you have a very good levels to get the revision, it's the time to come. You need to get lab test after your infusions. The ideal time is maybe 2 months after you start your infusion. If you do the lab test in 1 month and your levels are good, well, you can come. If not, you need to do again your lab test after maybe 2 months infusion and see the levels.
So they are asking if we have a system for people who do not bring companion to be informed after the surgery. Yes, our staff down at the hospital actually contact the member who was put on the consent form as a family member. They will be contacted and be informed about the surgery. I had my gallbladder removed. Does that disqualify me for gastric sleeve? So if they're
If you have the gallbladder removed, it's not a problem to get any bariatric surgery.
but you can also remove it if it's needed.
We can remove the gallbladder in the same surgery. If you have stones, if you have any problem before with your gallbladder, it's very recommendable to get off at the same time, because it's very, very high, the portion of eventualities after the weight loss surgery in your gallbladder if you had previous problem with your gallbladder. If you've never had, yes, increase a little the portion of possible stones in your gallbladder, but it's not mandatory to remove if you never had any problem with your gallbladder. But if you have, yes, it's very recommendable to remove.
My Zoloft give me heartburn sometimes. Will this get worse when I have sleeve surgery?
Yeah, the sleeve surgery could increase your acid reflux because we do a very small cavity in your stomach, the pressure increase. If you have weak your sphincter in your hiatus, well, that sphincter, that pressure push and open more that the sphincter and get the acid reflux coming to increase a little. And that is the reason we need to know how and what is the reason of the acid reflux. Sometimes it's just the food. With a special food you have acid reflux, like tomato sauce. That happens in all people. It's not because your sphincter is not working. It's the kind of food who is giving you the acid reflux. But with the sleep, it's not a problem because it's the quality of food who is giving you the acid reflux. But if you have acid reflux constantly with any kind of food, that means your sphincter is not working. And maybe you have a hiatal hernia and we need to repair that in the surgery. If you never had a big issue and after the surgery you have the issue acid reflux, we need to change your surgery to get that bypass, to don't continue having these issues with the acid in your esophagus, who is not the appropriate place to get the acid. In the chronic acid reflux, we can have a chronic inflammation and other issues after that.
How long before surgery they have to stop anxiety medications?
You don't need to stop the anxious medications to get the bariatric. Even you need to bring with you, because we will start the medications the next day after surgery to don't lose your effect. It's very important you bring your medications with you to start again immediately.
Now, sometimes you may apply for passport and you don't get it in time. I still think you should bring the application that you made, the receipt for your application, and bring your birth certificate and driver's license and a utility bill in your name, and that should help. Okay, so we are kind of going over because usually we try to stay within 1.5 hours, but we're going over 2. I still some good questions that need to be answered, but we're gonna have to just cut it here. And you're welcome to get those questions answered through your coordinators, and you can ask us again so we can definitely answer you. So I have all the names that are eligible, which means they are they have a HQ in our system, and they did attend the webinar today. And so I'm going to just take one name. So Tiffany Allen. Tiffany Allen.
Congratulations, Tiffany.
Now let me see if she's there so I can let her talk. Yep. I'm going to let you talk, Tiffany. So go ahead and talk to us.
I'm here. Thank you. how do I retrieve this for
Well,
making my payment?
yeah, so basically our coordinator, I'll let them know. You want to tell a little bit more about yourself and where you live and
I live in Oregon, and
Okay.
I'm trying to get this done as soon as possible. How long does it usually take to get an expedited passport, out of curiosity?
I think depends on where you are, to be honestly. I don't know. Sometimes if you have a flight, of course it has to be international.
Mhm.
Or if you get a letter from us, you can go to the passport office and actually they give it to you the same day.
Oh,
Yeah,
okay.
yeah. Look into that. And if not, I think it would be less than 4 weeks. When are you thinking to go?
Yeah, probably within the next 4 weeks or so. I was kind of
Okay.
waiting to find out about this and how you get there and if they pick you up and how you set that up. What if there's flight delays, all that stuff?
Yeah, they all, no worries. We get we always communicating with our drivers and we know when you're coming. If there is a delay, of course, we will let the drivers know. And you also have their number the day before your departure. They
Okay.
call you and they introduce themselves. You have their cell phone. You can text or call. You can also reach our office. So there is a plenty of support. You never have to worry about, getting stranded.
And do those drivers at the hotel also take people to the hospital to visit?
Of course. Well,
Okay.
depends on the hours. I'm not going to promise. Sometimes the drivers are gone if it's after hours. So, but most of the time they do.
Okay.
Okay, well, congratulations. We hope
Thank you so
you get
much. I'm so
better.
excited. I
Yes.
never win anything.
Yeah, that's great. So I will have the coordinator contact you. Thank you so much for everyone.
Perfect. Thank you.
We appreciate you, Dr. B, for taking time and be with us. Hope to see you soon down there.
Of course.
See you.
Yes,
Okay. Bye,
Thank you.
everyone. We see you
Thank
next
you.
time.
Thank
Bye-bye.
you.
Bye.
Bye.